Good evening, class. Today, we will be exploring the intricacies of pharmacological interventions in the treatment of Alzheimer's disease. Alzheimer's disease is a neurodegenerative disorder characterized by progressive memory loss, cognitive decline, and behavioral changes. It affects millions of individuals worldwide, making it a significant public health concern. As healthcare providers, it is crucial to understand the underlying mechanisms of action of various pharmacological agents used in Alzheimer's disease treatment. This knowledge will enable us to make informed decisions when prescribing medications to our patients. So, let's delve into the fascinating world of pharmacology and Alzheimer's disease treatment. Cholinesterase inhibitors, such as donepezil, rivastigmine, and galantamine, are commonly prescribed in Alzheimer's disease. These medications work by inhibiting the enzyme acetylcholinesterase, which is responsible for breaking down the neurotransmitter acetylcholine. By inhibiting acetylcholinesterase, cholinesterase inhibitors increase acetylcholine levels in the brain, leading to enhanced cholinergic neurotransmission. This neurotransmitter plays a crucial role in memory, learning, and attention. Cholinesterase inhibitors have been shown to modestly improve cognitive function and delay cognitive decline in Alzheimer's disease patients. NMDA receptor antagonists, such as memantine, are another class of pharmacological agents used in Alzheimer's disease treatment. These medications target the N-methyl-D-aspartate, NMDA, receptors, which play a pivotal role in learning and memory formation. In Alzheimer's disease, excessive activation of NMDA receptors leads to excitotoxicity and neuronal damage. By antagonizing these receptors, memantine helps regulate glutamate levels and prevent neuronal dysfunction. NMDA receptor antagonists have been shown to improve cognitive function and functional abilities in moderate to severe Alzheimer's disease. Aggregates of hyperphosphorylated tau protein form neurofibrillary tangles, a hallmark pathological feature of Alzheimer's disease. Tau protein stabilization agents aim to prevent tau hyperphosphorylation and subsequent tangle formation. These agents, such as methylene blue and lithium, work by inhibiting specific kinases involved in tau phosphorylation. By stabilizing tau protein, these medications have the potential to slow down disease progression and improve cognitive function in Alzheimer's disease patients. Beta-Secretase, BACE, is an enzyme involved in the production of amyloid beta, a beta-peptides, which accumulate in the brains of Alzheimer's disease patients. Beta-Secretase inhibitors, such as varibacestat and lanabecestat, block the activity of BACE, thereby reducing the production of A-beta peptides. By decreasing A-beta aggregation, these medications aim to slow down disease progression and attenuate cognitive decline in Alzheimer's disease. Gamma-Secretase is another enzyme involved in the production of A-beta peptides. Gamma-Secretase modulators, such as semigacestat, target this enzyme and modulate its activity. These medications aim to reduce the production of harmful A-beta peptides while preserving the physiological functions of gamma-secretase. However, the clinical use of gamma-secretase modulators is challenging due to the complex biology of gamma-secretase and the potential for off-target effects. Immunotherapy represents a promising approach in Alzheimer's disease treatment. Monoclonal antibodies, such as aducanumab and solanezumab, target A-beta aggregates and facilitate their clearance from the brain. By promoting A-beta clearance, immunotherapy aims to halt disease progression and improve cognitive function in Alzheimer's disease patients. However, the use of immunotherapy in Alzheimer's disease is a topic of ongoing research and holds various challenges, such as antibody penetration into the brain and potential side effects. Neuroprotectants are pharmacological agents that aim to protect neurons from damage and preserve their functions. Examples of neuroprotectants commonly used in Alzheimer's disease include antioxidants, such as vitamin E, and anti-inflammatory agents, such as nonsteroidal anti-inflammatory drugs, NSAIDs. These medications target oxidative stress and neuroinflammation, which are key contributors to neuronal dysfunction and degeneration in Alzheimer's disease. Neuroprotectants have the potential to slow down disease progression and improve cognitive function, although their efficacy requires further investigation. Insulin signaling abnormalities have been identified in the brains of Alzheimer's disease patients, leading to impaired glucose metabolism and energy deficits. Pharmacological agents targeting insulin signaling pathways, such as metformin and intranasal insulin, aim to restore insulin sensitivity and enhance brain glucose uptake. By improving energy metabolism, these medications have the potential to delay cognitive decline and improve memory function in Alzheimer's disease. In addition to beta-secretase inhibitors and immunotherapy, several alternative approaches are being explored for targeting amyloid beta accumulation in Alzheimer's disease. These include anti-aggregation agents, metal chelators, and antibodies targeting specific A-beta conformations. These alternative strategies aim to prevent A-beta aggregation, promote clearance, or modify the toxic properties of A-beta aggregates. Although still in experimental stages, these approaches hold promise for future Alzheimer's disease therapies. Mitochondrial dysfunction plays a crucial role in the pathophysiology of Alzheimer's disease. Impaired mitochondrial function leads to bioenergetic deficits, increased oxidative stress, and neuronal damage. Pharmacological agents targeting mitochondrial dysfunction, such as coenzyme Q10 and nicotinamide adenine dinucleotide, NAD+, precursors, aim to improve mitochondrial function and delay disease progression. By enhancing mitochondrial respiration and reducing oxidative stress, these medications have the potential to preserve neuronal integrity and improve cognitive function. Epigenetic modifications, including DNA methylation, histone modifications, and microRNA expression, play a significant role in Alzheimer's disease pathogenesis. Pharmacological agents targeting epigenetic processes, such as histone deacetylase inhibitors and DNA methyltransferase inhibitors, aim to modulate gene expression and restore normal epigenetic patterns. Epigenetic modulation holds promise for Alzheimer's disease treatment by influencing disease-related pathways, such as A-beta production, tau phosphorylation, and neuroinflammation. Multiple neurotransmitter systems are impaired in Alzheimer's disease, including the cholinergic, glutamatergic, and serotonergic systems, among others. Pharmacological agents targeting these systems aim to restore neurotransmitter balance and improve cognitive function. Examples include cholinesterase inhibitors, NMDA receptor antagonists, and selective serotonin reuptake inhibitors, SSRIs. Neurotransmitter system modulation represents a multifaceted approach to Alzheimer's disease treatment, targeting multiple neurochemical imbalances simultaneously. In conclusion, treating Alzheimer's disease with medication is complex and constantly changing. Different approaches have been studied, such as improving communication between nerve cells and targeting protein clumps, inflammation, energy production, and genetic changes. Some medications have shown promise, but there are still many challenges to overcome. As future healthcare providers, it's important to stay updated on Alzheimer's treatment to provide the best care. We hope to find better treatments and a cure with ongoing research. Thank you for your attention, and let's continue discussing this important topic.